Good afternoon, it's Mark Larson at Public Health, and I'm here to talk about COVID-19, and I'll talk about a couple of other things that are happening from a public health perspective. So we currently have 2 new positive cases. We've been doing really well. A week ago Monday we had 1 case, and then we went 5 days without any cases, and then we've had a couple of cases in the last couple of days. One of those cases, as most people have known, is a person who got sick on Wednesday. That person's doing okay and is in quarantine at home. That person actually went to the March for Social Justice that was organized by a couple of high school students. They were wearing a mask the whole time, and so our recommendation from Public Health is for us not to worry about that currently. But if you were at the social justice marches on Monday and Tuesday of last week and you develop symptoms of COVID-19, you should go get a test, but otherwise there's no real reason for you to test. The other new case is somebody who works in Yakima, so they wouldn't actually be counted as one of our cases. So they live in Yakima, but they work up here, so they'll be counted in Yakima. But it shows how we go back and forth between Yakima and here, and Yakima currently has over 100 deaths, over 4,000 cases. They're getting over 100 cases, new cases every single day. So it just goes to show, as we start to move forward from phase 2 to phase 3, that we still need to be aware, we still need to be keeping social distancing, and we still need to be washing our hands. So that's going on currently. In regards to something that's not COVID-19 related, we did have a water main break in Cle Elum, and the state has said we now have to have a water boiling ordinance because water is not safe to drink, which means all of those restaurants in Cle Elum that were able to open can no longer be open until we release that water boiling order from the state, because it's not safe to be cooking in that situation. So that's state guidance, but hopefully we'll get those water samples back in a couple of days and we'll be able to open back up again. So let's go ahead with some questions.
I'm giving birth soon. Since we are in phase 2, why weren't the hospital policies updated for the number of support persons a woman in labor can have? I called and was told it was for the safety of my unborn child and myself. If me and my newborn are allowed to go to a public restaurant at 50% occupancy that have 5 people per table, why am I not allowed to have my mother and the father of my baby in the room?
Yeah, so those are hospital policies. Those aren't necessarily public health policies, but as a pregnant woman, you are at high risk of complications of COVID-19. So they are doing their best to protect you. Doesn't mean you can't, outside of the hospital, go to a restaurant. We would never tell a pregnant person not to go to a restaurant, but it would be smart not to go to a restaurant because you're at higher risk. So I know the hospital is looking at their policies and procedures all the time, and I know that they're looking again at that document of who can actually be involved in the delivery, because we know that that's really important. And I would just check with them again because it's changing, and we know that having support people at delivery is really important.
At the beginning of this pandemic, we were concerned about overpopulating our hospitals. Fortunately, this has not happened. With that being said, why are we concerned with how many new cases there are or how many past cases we have had, instead of concerning ourselves with how many current cases we have that are in the hospital? To some extent, if we ended up with 20,000 new cases and no one is in the hospital, isn't that okay? Yes, it is a bummer that people are sick, but this becomes no different from the common cold or flu then, correct?
Well, that part's incorrect, but the death rate for COVID-19 is much higher than the common cold or the flu. And the other part of that that's a little misleading is that it is looking at hospital overflows. So we were not overwhelmed with COVID patients at Kittitas County Hospital. So we've actually had 2 patients hospitalized for COVID-19 at our hospital. Where'd they come from? They came from Yakima. Why'd they come from Yakima? because they did not have room in their hospitals for their COVID-19 patients. So traditionally, over the last 22 years when I worked in the hospital, we have transferred patients to Yakima because they're a higher level of care than we are. But currently they're having to transfer patients here, and not just COVID-19 patients, but other patients because they don't have any room for those people. So we have been blessed here with not having had any deaths from COVID-19, nor have we had very many hospitalizations, but our neighbors have had deaths and hospitalizations. So currently we have to be concerned about that. So I could tell you how many deaths we have every day when we talk, but that doesn't seem to make sense. It's still been zero. And one of the metrics that we have going forward from phase 2 to phase 3 is how many people we have in the hospital, how many COVID-19 patients we have in the hospital. So we are looking at those metrics. So we've just been fortunate, and mostly due to the fact that people have been really good at maintaining social distancing and staying at home. That's why our numbers have been so low.
Why haven't you made the masking directive mandatory?
Oh, I wish that I had made the masking directive mandatory. So the masking directive, so I asked for people to wear masks. And to be totally honest, it was confusing because at first the World Health Organization said wearing masks weren't really helpful. But like lots of other things with COVID, as we've learned more, we've learned that masking is one of the things that we can do to protect others and keep our numbers down. So if you want to protect others, you should wear a mask. If you want to move into phase 3, you should wear a mask. And so we kept asking, and then we had a directive, which was a little stronger ask. And then when the governor came out on Monday, when the governor came out on the 31st and changed his order, it put into place as of last Monday, the 8th, anyone who's in a room that they're not by themselves in an office has to be wearing a mask. So now masking is mandated. So we are there with mandated masking. So moving forward, we can all wear masks. We can all keep the numbers down. We can all not have our restaurants open in Upper Kittitas County while there's a water boiling order in place, so people don't get sick. And then on the 17th, if our numbers stay low, we can put our form in asking to be moved into phase 3. That'll go in front of the state or in front of the county Board of Health on the 18th, which is a Thursday. It'll go to the governor's office and to the Secretary of Health's office that day, on that Thursday, and hopefully within a couple days after that, we'll be in phase 3. So remember to be kind, look out for others, give tips when you can, buy local, and we'll see you tomorrow. Thanks.